Welcome to DCF Cost Report Training. This is session 1 of 8 sessions that will be available. Session 1 here will cover the guidelines tab on the cost report. It'll also cover the user guide. It'll cover changes that were made to the cost report since last year. And we'll also cover some of the definitions, some of the changes in the definitions. Presenting today, my name is Steve Erkman. I'm with the Department of Children and Family in the finance area. And I will be covering these different sessions for training. To get started here, the first tab then that we're going to look at, which is on the cost report, is the guidelines tab. A few things to remember on the guidelines tab is that a provider must submit a cost report for each provider ID. So if you run 3 separate group homes and each group home has a separate ID number, you are going to need to submit a separate cost report for each one of those group homes. Last year, I know I let a few providers submit a cost report for more than one provider ID, but this year, if you have a provider ID, you have to submit a separate cost report for each one of those IDs. Another reminder is to make sure the tabs along the bottom of the cost report, make sure you do not change those names. One thing that's expected this year, it is expected that your cost report will tie out with your audit report, or at least be reasonable. Obviously for larger agencies that have multiple programs and reporting on multiple cost reports, that'll be a little more difficult, but the expectation is that your audit report will reasonably tie out to what you reported on your cost report. If you have additional expenses that you realize since the year that you're reporting your costs, so for this year you'll probably be reporting your 2012 expenditures. And if you had additional expenses or additional programs you added or cost of increase, taken on additional costs or decreased costs in certain areas, what you want to do is include those then in the assumptions tab. And you don't want to include those costs in your cost report, otherwise your cost report will not tie out to your audit. One thing is to make sure if you put those assumptions in the assumptions tabs, to make sure you give us plenty of description and clarification of what those assumptions are, so then DCF Finance will decide whether those assumptions should be added to your cost report or not for setting the 2014 rate, ceiling rate, as well as setting your individual 2014 rate. The department this year is requiring that all cost reports be submitted electronically. If you scroll down towards the bottom here, you'll see that. Also, it'll give you where the cost reports need to be submitted to. All cost reports need to be submitted by July 1st of 2013. If cost reports are not received by that date, a non-compliance letter will be issued, and you will be charged a $25 fine for each day the cost report or the audit reports are not received by DCF. So it's very important that you make sure that you get your cost report as well as the audit completed and finished to DCF prior to July 1st of 2013. Also here on the guidelines is the user guide. You click on that user guide, that'll bring up the user guide for 2014. If you scroll down on that, that user guide is again just another area where it can give you some assistance in completing your cost report. For example, here it shows us the cover tab, and all the highlighted yellow fields are the fields that must be completed by providers. And as you can see, each one of those yellow fields has an explanation of what's expected to be put in that. For example, the fiscal here with the first one, it's enter the beginning date of the fiscal period being reported. So as we go through that, it's going to give you what we're looking for in each one of those cells. And again, it's going to be the highlighted yellow cells. As we go down, you can see the verification tab, and you'll be able to see all the other tabs that need to be completed in the cost report by the providers. You have the assumptions tab there, the personnel tab, and everything else. So again, that's another resource that everybody has available to them. The next tab over is the changes tab. Again, these are the changes that would have been completed to the cost report since last year. It's something that you're probably going to want to read through so you know what changes have been made. Hopefully some of the changes will make it a little simpler for providers to complete the cost report here in 2013 that'll be used for setting the 2014 rates. Just to go through a few things, again, we already touched that each provider ID number must have a separate cost report. One thing we will allow this year as well is we'll allow employees with the same primary job category to be entered on one line. So if you're a large agency and you have 50 staff that provide direct care to the kids, you can report all those in individual lines for 50 lines if that works the best for you. Or what you can do is you combine all those on one line. One line is direct care with their total hours, their total wages, their total benefits, total taxes, all that could be just on one line instead of having to put a separate line in for each one of your employees. We updated the definitions, which we'll cover here shortly. We removed some things from the cover tab, which we'll also cover in future sessions that are being recorded. We've eliminated some of the cost categories on the property and transportation tabs, the consumables tab, and also on the personnel tab. We have made some changes to eliminate a few things. Some of the cost categories that were requested, like years of service, education requirement, vision, health, some of those things. And we have also reduced the number of departments in the drop-down from 16 down to 6, as well as the number of job categories you can select from 150 down to 48. So hopefully that'll simplify things for everybody. On the review checklist, we have also enhanced the checklist that providers must complete before submitting the report, and also have enhanced the checklist of what DCF needs to complete once the report is submitted. So if you're wondering what DCF checks and reviews, once you submit the report, you can check the review checklist and check for what DCF steps are on their checklist. The next tab over, and the last tab we're going to cover in this training, is the definitions tab. Again, the definitions tab is another resource that providers have out there if they have questions to give them clarification. What you're going to find here on the definitions tab is on the first line. It's going to tell you whether it's a cover tab, verification tab, or what tab we're looking at for what cell you're looking for a definition for. The next is going to tell you what section it is. It's also going to tell you which line, and then the subsection. A couple of definitions that I want to clarify here is the licensed capacity beds available daily. Again, this is the number of beds that your program facility is licensed to operate on a daily basis. So if you're licensed for 200 beds, you're going to want to enter 200 into the licensed capacity beds. The exception to that is, let's say you're a CPA that you're licensed for 200 beds, but in the reality, your capacity as far as your foster parents, so on and so forth, is truly only 100 beds. What you could do is change that to 100 beds capacity, licensed capacity, and then documenting the assumptions that even though you're truly licensed for 200 beds, your true capacity, because of whatever circumstances, is only 100 beds. And again, you're going to want to make sure you clarify that in the assumptions tab. So when we compare what you're reporting for licensed beds compared to what you're licensed for, we'll have that clarification and can justify whether that is accurate. The other change is on the program staff beds. Again, the program staff beds should be the number of beds that your program facility staffs at on an average daily basis. Again, that number needs to be lower than what your license capacity is, and yet it needs to be higher than what you're stating what your actual average daily placements are. Along with that, we kind of put in some formulas to give you an idea of how that would be calculated if you're having an issue of reporting what your staff beds should be. And that concludes session 1 of session 8. Thank you very much.